The coronavirus vaccine is slowly getting rolled out for healthcare workers, but there's a new warning to those with cosmetic facial fillers. Dr. Richard Chaffoo is here to break this all down for us. Good morning to you, Dr. Chaffoo.
Good morning, Kristina.
Okay, so what exactly are doctors seeing, and with all the cosmetic fillers, that we're talking about? So that includes Botox. What else?
Well, actually, it's more with dermal fillers. They didn't really see this with Botox patients, but they actually, and it's important for everyone to know, Kristina, that this is only seen with the Moderna COVID-19 vaccine. Of the 30,000 people in their trial, there were actually 3 people that actually had reactions to the vaccination that were very self-limited. So, if you look at dermal fillers in general, there are millions of people every year that have dermal fillers, and they're done very safely, if done by board-certified dermatologists and plastic surgeons. And what they found, Kristina, was that there were a couple of patients who had cheek fillers. And these were with what we call HAs, or hyaluronic acids, which are actually naturally occurring products. And there was one that was with a lip filler that occurred 2 days after the vaccination. But again, they were very self-limited. They all responded to treatments, including like oral steroids and oral antihistamines. It's important to understand that none of them had serious reactions. None of them required an EpiPen injection, so there was no anaphylactic-like reaction. Certainly, nobody had to go to a hospital and be hospitalized. So these were very self-limited self-limited reactions, I should say.
Okay, but Doc, you also said that for some of them, these side effects weren't even popping up until 2 days after they got the vaccine. So
that was in one. Yeah, that was
okay.
one patient with a lip filler. That was
okay.
Was a couple of days later.
So for anyone who has these dermal fillers, right? Because you hear the headline, and then people might get nervous. What is your advice to people who have these types of dermal fillers?
Yeah, I think it's important, to communicate that with whomever is giving you the vaccine. And if we use historically what we've done with patients who have been candidates for dermal fillers, what we usually would tell people is, make sure, for example, a dental injection or, strong dental cleaning, you would want to wait 2 weeks before and 2 weeks following that before you would get a vaccination, because there's always that risk of a bacteria getting into the system. And so probably with the dermal fillers and the vaccination, probably the same thing applies. You'd want to alert your healthcare provider, that you've recently had a dermal filler. And probably if you've had this filler within the past 2 weeks during that window, you probably would want to wait to get the vaccination. Again, this is being ultra conservative because we don't have a lot of data. And I think it's important for people to realize that there have been no life-threatening reactions to these vaccines in patients that have had dermal fillers done. Obviously, if you're going to get the vaccination done, you want to make sure, and you would, of course, with the government regulations being what they are, that it be done in a properly selected facility where they do have, for example, they have EpiPens if, God forbid, there was a serious allergic reaction, that you would be able to have an EpiPen available. But that's an extremely rare situation. And again, out of those 30,000 people that received that Moderna vaccine, there were only 3 cases. So it's extremely rare. It's not a very common occurrence.
Okay, so extremely rare. And now on the other side of it, how soon, so for people who are looking to get a dermal filler of some sort, and say they get the vaccine, how long should they wait until they actually get another filler?
So I think that the time period to wait would be, I'd say, a minimum of 2 weeks, just because we're using historical data from how we dealt with patients regarding dental treatments. And I think it's very important to let the public know that the risk of side effects from getting a vaccine with dermal fillers is much less than not getting vaccinated at all, because of that fear and exposing yourself and your community to COVID-19.
Okay. All right. So as we're learning, as we are going and moving forward.
Right.
But Dr. Chaffoo, I do thank you for your time. Thank you for filling us in.
Thanks, Kristina.